Well, good afternoon, everybody. Thank you so much for coming along to, which is the fourth of these events, which is sponsored by Macmillan Cancer Support, so in partnership with the University of Leicester, the Genetics Education Centre, GENI, and also the Clinical Genetics Department at the Leicester Royal Infirmary. Now, when we started this concept, which is the supporting families with cancer concept, it's very much of the feeling that in the genetics department we come to talk to people, we say whether or not you may have an underlying inherited susceptibility to cancer. And I was always very frustrated about what else we could actually do. Yes, we can refer people for screening, but it didn't really feel as if we were adding a great deal more than that, be it from a counselling perspective, psychological, psychotherapeutic perspective, but also from a dietary perspective, exercise, physiotherapy, but also links into preventative surgery. Also, we work very closely with our research partners in the university. And clearly, inherited breast, ovarian, prostate cancer, really big problems in our society. And there's a lot of research going on all the time. We'll be talking today about a number of recent developments. We've got Dr. Jackie Shaw, who's uploading a talk at the moment, who'll be talking about the project that we've been doing, trying to develop a blood test to detect cancer at an early stage. We've also got talks from Dr. Joyce Solomons, who is one of the new clinical geneticists in Leicester. I'm delighted that she's come to join us. And we've also got talks by one of our genetic counsellors, Dimitra Georgiou, at the back, about discussing in families inherited susceptibility to cancer. I'm delighted that also two of our surgeons have come today, very kindly come along today, to talk about preventative surgery, and we'll be introducing them through the day. We've got parallel sessions as well, and we have a number of groups downstairs today, and local partners who have very kindly also come along. We've got Prostate, which is a local prostate cancer charity. We've got our Macmillan Cancer Support team here from the Leicester Royal Infirmary. We've also got the National Hereditary Breast Cancer Helpline. We have a group from Loughborough University who've come along today. Obviously, we have the dietitians and the physios who are involved in parallel sessions. We have our chemo prevention team who are developing drugs from natural food substances to help reduce the risk of cancer, such as bowel cancer through curcumin, which is in curry powder. We've got our public patient involvement group here today. We have Paula Ray at the back, who's working as part of the CLARK, which is how do we take good research practice from a journal on a shelf to actually improving outcomes for patients. And that's called the second translational gap. How do we get research actually into action to make things better for our patients? There are only really two main thank yous I wanted to say. Firstly, to Joe, because Joe has put a huge amount of work in, not just for this event, but over the last nearly 4 years now, developing the support, 3 years, feels like 4, no, the Supporting Families with Cancer project, I was joking, don't know. Bringing together the Supporting Families with Cancer network. We've got podcast channel now, we've got a YouTube channel, we have a website for the concept of supporting families with cancer. We have links with medical psychology. Delighted that we've been able to develop a psychotherapeutic angle to our work and clinics that Penny, one of our counsellor, runs, which is fantastic because obviously families have a lot to deal with when their families are affected with cancer through multiple generations. So I'm delighted that we've been able to develop this as a format, and absolutely delighted that, oh great, this all happened behind me, that we can go on, hopefully, working together with patients. So number one was for Joe, and the second one is for the patients who've come along and all the stakeholders to support the event, because if people didn't come along, then obviously we wouldn't be able to take this forward. The concept for me, moving forward, is to actually try and get the message that cancer can be inherited out into the high streets, out into charity shops, out into libraries, and improve the understanding not only of the community but in primary care. We developed a training program through palliative care. We hope to be able to do in the future, take that through primary care as well. Too many times I end up seeing people who are told, don't worry about that family history, it's on your dad's side. Don't need to worry about this. It's not going to be inherited. Letters even being thrown in the bin from genetics departments we've been told about. There is a gross amount of misunderstanding about cancer. The majority, of course, is not inherited, but when it is, there are so many things that can be done. I hope today we put out a very positive message that there are a huge number of things that are being done in research, but also that are now in clinic in reality to help families moving forward. So we can go from supporting families to support and protecting families. Brilliant.